Okay, so if you've watched my last video all about what a diastasis recti is, this is just a short video to show you how to assess for a diastasis, and you can check if there's any gap at all. So you can do this sitting, you can do it lying down with your knees bent. Some women prefer that because you're a little bit more relaxed. But basically what you want to do is come just to the bra strap area and then begin to just feel down the midline area of your abdomen, and you want to go the whole way down towards your pubic bone and underneath the belly button, and basically you're feeling for if your fingers are sinking inwards. Okay, so you can get an idea of the length of your diastasis. The other thing you can do as well, if you get your 3 fingers and go across the width, you can basically check how wide it is as well. So sometimes what can be useful is if you feel that you're going all the way in and you're not sure how much tension there is, if you bring your chin to your chest, often what you'll find is you feel the 2 sides of the rectus muscle squeezing. So basically you can see, is it 2 fingers, 3 fingers, 4 fingers wide? Can you get your whole hand in there? So yeah, it is always good to just check for the width, and also to check how much tension there is, because it can be that you've only got a 2 finger diastasis, but you're going in maybe up to the knuckle area. Okay, you can use that as a landmark. Or it might be you've got a diastasis that's 4 fingers wide, but it's actually quite shallow and there's good tension. And that's important to know, because if you've got poor tension, we need to do exercises to build up that tension, okay? Whereas if you've got good tension, then it means we're probably going to start with different exercises. And that's why with the rehab, it's always good to know your width of your gap, the length of your gap and the tension, because it means then we can make the rehab quite specific to yourself. Also to bear in mind as well that if you're sitting or standing, gravity will pull your abdominal contents forward, so sometimes then your abdomen might look a little bit more pendulum, or the bulging might look a little bit more. So yeah, so it might be worth to begin with, lie yourself down, bend the knees as you're checking the gap, and it's good to do it in lying, do it in sitting, so that you've got a little bit of a comparison.